my belly not feel good at all, you know. My belly bottom not feel good at all. I just had to pain me like a so sharp pain me I feel, you know. Not feel good at all. I just had to swell up and something. You know, me I wonder if I earn it, you know, because I remember Samantha did tell me so she did have, you know. No me how go up a person junior go find out how I go and do. I'll get ready and come out there, man. Okay, Miss Brown, how are you doing today? Morning, I don't feel so good at all, you know. What's happening? Look, you up this morning, and I tell you, say, you liar, sir. It's swell up, look there, look how it's at. It's swell up, me, I tell you, nurse. And that's some sharp pain, me, I feeling some sharp, you know what I'm saying? Is it radiating in your head? Why? It a run up and down from yes or 2 years, so I said, don't you want to go on Monday. So how long have you been feeling this? You know, say last night, me get up, do I feel it, bro. I'm here, and my friend come and tell me, say, no, I'm a certain, you know. So I said, I want to come up here and come figure out how I'm going to come. I can't believe this place, you know. Alright. I'm going to ask the nurse to do an assessment, and then I'll do mine, and then I will let you know what's going on. You want some this? I want them to see what is going on. Alright.
What is inguinal hernia? Inguinal hernia occurs when abdomen tissues such as belly fat or loop of intestines bulge through an opening in your lower abdomen wall. This is a wall that separates your abdomen from your groin. Inguinal hernia occurs in the inguinal cavity, which is a passageway that runs down either side of your pelvis into your sex organs. They are also called groin hernia. So what are the risk factors or causes of inguinal hernia? Causes of inguinal hernia include an opening or weak spot present at birth, an opening or weak spot from a previous abdominal surgery, chronic cough and sneezing, chronic strain during defecation and urination, frequent strenuous activity or manual labor, many years of carrying a child or due to pregnancy. Also, jobs that require standing for many hours at a time and normal age-related tissue degeneration. Risk factors associated with inguinal hernia. So, family history. You may have a close relative such as parents or siblings who have this condition, so therefore it is passed from one generation to another. Being a male, males are 8 to 10 times more likely to get inguinal hernia than a female. Being older, so as you age, your muscle becomes weaker. Alright, so this contributes to inguinal hernia. Long-lasting cough. This will be a result of excessive smoking. Long-lasting constipation. This occurs when there is strain during bowel movement. Pregnancy. Being pregnant can weaken the abdomen muscle and cause increased pressure inside the abdomen. Premature birth and low birth weight. Inguinal hernia are more common in babies who are born prematurely or to low birth weight. Another factor would be previous inguinal hernia or hernia repair. Having a previous hernia in childhood increases a risk of forming another hernia later on in life. So these are risk factors that help to contribute to the forming of inguinal hernia.
Hello, I'm student nurse Malia Lewis, and today I'll be discussing the pathophysiology along with the clinical manifestations of inguinal hernia. Let's start with the pathophys. There are multiple factors that contribute to this weakening of the groin muscles. Stress or increased pressure use of muscle can cause inguinal hernia. The main reason behind inguinal hernia is muscular damage. In the cells of the muscle, multiple problems may occur leading to the damages. A patient might have developed some form of inflammatory muscle disease like myositis caused by a virus, bacteria, or a parasite. This is where the muscle fibers accumulate multiple proteins, creating weakness and pain to the muscles. This would cause the muscle to be prone to injury due to the increase in stress towards the endoplasmic reticulum from the extra proteins the pathogens are creating in the body. Overuse of muscles can cause it to become weak and inflamed. The muscle requires more oxygen during this time, and if the higher oxygen demands is not met, this will lead to cellular damage, cellular death. During the inflammatory process, the muscle can be easily displaced, causing the bowel to protrude, which initially shows the bulge, creating the inguinal hernia. As someone ages, their muscles become progressively weaker and more likely to give out faster than in younger years. This is mainly due to the changes in the cellular growth process brought on by free radicals. The longer a person lives, the more likely changes can occur in their cellular DNA. Also, as someone ages, if they are less active or mobile, it can cause atrophy of their muscle, and this is normal process where cells decrease in size since they are not in high demand of use. All that pathophys is saying, when you think about inguinal hernia, think about the damage or weakness in the muscles that cause or lead to this. Inflammation or strain of the muscle during physical activity can be a cause, and when a person during the physical activity, the muscle need more oxygen to function properly, and if this required oxygen is not given, it will become or allows the muscle to become damaged or die. And if this weak or damaged muscle, it would allow part of the intestine to push through the abdominal wall, creating the bulge that is seen and classified as inguinal hernia. Clinical manifestations of inguinal hernia. Symptoms include a bulge in the area on either side of the pubic bone, which becomes more visible when upright, especially when coughing or straining. A burning or aching sensation at the bulge. Pain, discomfort, or pressure in the groin when bending over, coughing, or lifting. Periodical pain and swelling around the testicles when protruding intestine descends into the scrotum, in what is related to the men. Symptoms in children. Children with inguinal hernia seen only when crying, coughing, or straining during a bowel movement. They might be irritable and have less appetite than usual. Signs of trouble. If a hernia can't be pushed in, the contents of the hernia may be trapped into the abdominal wall. This is known as incarcerated hernia. An incarcerated hernia can be strangulated, which cuts off the blood flow to the tissues that strap. A strangulated hernia can be life-threatening if it's not treated and can lead to further complications. Symptoms of strangulated hernia includes nausea or vomiting, fever, sudden pain that quickly gets worse, a hernia bulge that turns red, purple, or dark, not being able to move the bowels or flatulence, passing gas or so. So whenever you see these classical signs or symptoms, it's best to seek medical attention.
Diagnostic evaluation for an inguinal hernia. So, a physical examination is usually enough to diagnose an inguinal hernia. And a clinician will examine the groin area for a visible bulge. They will either ask them to stand or cough, and this is to make the hernia more visible. And patients are often asked to stand and cough or to strain to detect it. If the inguinal hernia is not visible during the physical examination, a healthcare provider might order an imaging test such as an abdominal ultrasound, a CT scan, or an MRI to confirm the diagnosis. Medical management. If the hernia is small and not causing symptoms, a healthcare professional might recommend a watchful wait. In most cases, they would suggest wearing a supportive truss, a belt,
to relieve discomfort, ensuring that it is fit properly and that it is used correctly. For children, a healthcare provider may attempt a gentle manual reduction of swelling before surgical intervention. That is, using gentle touch or gentle push motion to push the hernia back into the abdomen to reduce swelling. So, painful or large hernias typically require surgical treatment to reduce symptoms and avoid complications. Now, there are two different types of hernia operation: open hernia repair and minimally invasive hernia repair. Minimally invasive hernia repair. So this surgery is done under general anesthesia. The surgeon makes several small abdominal incisions, inflating the abdomen with gas or visibility, and uses a laparoscope with a camera to guide the instruments. So this hernia is repaired with synthetic mesh. So compared to open repair, minimally invasive surgery may reduce post-op pain, scarring, and recovery time, though long-term outcomes are similar. And this surgery can help patients to avoid scar tissues from previous surgery. It is often recommended for recurring surgery or bilateral hernias affecting both sides. So, like open surgery, full recovery and return of normal activities take several weeks.
I am student nurse Amoy Williams, and I will be doing the nursing management of inguinal hernia. Nursing management of inguinal hernia. 3 priority nursing diagnoses for a patient with an inguinal hernia include acute pain related to tissue protrusion and surgical intervention, risk for infection related to surgical incision and tissue trauma, deficient knowledge related to post-operative care and prevention of reoccurrence. For acute pain related to tissue protrusion and surgical intervention, so nursing intervention include assessing the patient's pain level regularly using an appropriate pain scale, administering prescribed analgesics, and assisting the patient into comfortable positions, and encouraging splinting of the surgical site when coughing or moving. The nurse should also monitor for worsening pain, which may indicate complications such as incarceration or strangulation of the hernia. For the risk of infection related to surgical incision and tissue trauma, the nurse should monitor the surgical wound for redness, swelling, warmth, drainage, and or separation of wound edges. Aseptic technique should be maintained during dressing changes, and the patient should be educated on proper hand hygiene and wound care. Vital signs, particularly temperature, should be monitored for signs of infection. For deficient knowledge related to post-operative care and prevention of reoccurrence, patient education should focus on avoiding heavy lifting and strenuous activities during recovery, right? Patients should be encouraged to treat chronic coughing promptly as soon as possible, as persistent coughing increases intra-abdominal pressure and may place stress on the surgical repair. Education should also include maintaining adequate fluid and fiber intake to prevent constipation, which can allow the patient to strain while passing stool, right? Recognizing signs of complications and attending follow-up appointments. Just some other health education or health promotion. Avoid heavy lifting. Just remember, avoid heavy lifting and use proper body mechanics during daily activities. Maintain adequate fluid and fiber intake to prevent constipation and straining. Seek treatment for chronic coughing and maintain a healthy body weight to reduce intra-abdominal pressure and decrease the risk of hernia recurrence.
Complications that arises from inguinal hernia. Incarcerated hernia. This is when the protruding tissue, which is normally an intestine, is trapped in the hernia sac and cannot be pushed back into the abdominal cavity. The opening to the abdominal wall is narrow, which prevents the tissue from being put back into its original position. Strangulated hernia. This is when the blood flow to the incarcerated hernia is decreased. Without adequate blood flow, oxygen and nutrients cannot be carried to the affected tissue. 3. Intestinal obstruction. This is when a portion of the intestine is trapped in the hernia sac and causing the movements of the intestinal contents to be blocked. 4. Septic shock and sepsis. This is when the infection causes the body to shut down. In other words, all the organs in the body is now malfunctioning.
Did you know that many people think a hernia is just a minor issue that will heal on its own? In reality, if part of your intestine gets trapped in the groin area, it can lose blood supply and even die, meaning surgery is the only safe fix. So how exactly do doctors push it back into place? Before the surgery starts, you'll be given anesthesia so your whole body relaxes. You won't feel a thing. Next, the surgeon makes a small incision about 5 inches long, right above the groin, like opening a little door to reach the problem area. They carefully separate the muscle layers until they find the bulging hernia sac inside it, a bit of intestine that slipped out of place. The surgeon gently moves it back into the abdomen where it belongs and stitches the sac closed with precision. To make sure the weak spot doesn't reopen, they place a strong surgical mesh, think of it like a safety net, to reinforce the area. Finally, the muscle layers are stitched back together, and the skin is closed neatly. Just like that, the repair is done. Most people recover and return to normal activity within a few weeks. Hard to believe, right? This entire delicate procedure usually takes just about an hour. Would you get it fixed early or keep toughing it out?